properly. So you are at greater risk for kidney disease if you have diabetes or high blood pressure. If you experience kidney failure, treatments including kidney transplant or dialysis. Other kidney problems include acute kidney injury, kidney cysts, kidney stones, and kidney infections. What are the normal functions of the kidneys? So these are the normal functions, which includes: number 1 is kidney removes waste and extra fluid from your body. Kidney also removes acid that is produced by the cells of the body and also maintain a healthy balance of water, salts and minerals like sodium, calcium, phosphorus and potassium in your blood. So here you can see blood, which is unfiltered blood, enters the kidney and then it enters the nephrons, which are present in the kidney, and blood is filtered here. Here you can see the nephron and its parts. Then the filtered blood moves through these veins and the urine passes through this tube, which is called ureter. Renal disorders which we will discuss here are proteinuria, renal tubular disorders, and renal calculi. Here in this diagram, you can see bean-like structure of kidney, and this is nephron, which is its functional part of the kidney. This is a renal cortex, and this inner part is renal medulla. This is renal capsule, and this part is the ureter through which the urine leaves the kidney and leads to the bladder. First of all, we will discuss the proteinuria. What is proteinuria? It is the presence of excess proteins in the urine. In healthy persons, urine contains a very little protein, and excess is suggestive of illness. Excess protein in the urine often causes the urine to become foamy, although this symptom may also be caused by other conditions. So mainly the proteinuria is the presence of the excess of the proteins in the urine. So here, what are the causes of the proteinuria? Protein is normally found in the blood. If there is a problem with your kidneys, protein can leak into your urine. So there will be excess of the protein in the urine. While a small amount is normal, a large amount of the protein in urine may indicate kidney diseases. In many cases, proteinuria is caused by relatively benign or non-cancerous or temporary medical conditions. These include dehydration, inflammation, and low blood pressure. So we can say that it is caused by these medical conditions and due to the intense exercise or activity, emotional stress, aspirin therapy, and exposure to cold can also trigger the proteinuria. So these are the conditions that are related to the proteinuria. Symptoms. Most people who have proteinuria wouldn't notice any signs, especially in early or mild cases. Over the time, as it gets worse, patient might have symptoms including foamy or bubbly pee, swelling or edema in the hands, feet, belly or face, peeing more often, shortness of breath and fatigue, loss of appetite and upset stomach and vomiting, or the muscle cramps at night. Protein and urine risk factors. So what are the risk factors which are related to the protein in urea or proteinuria? These are following: obesity, age over 65, a female family history of kidney disease, and some people get more protein into their urine while standing than while laying down. This condition is called orthostatic proteinuria. If we talk about evaluation of proteinuria, a normal value in the healthy adults is less than 150 mg. Low-grade proteinuria or mild proteinuria or protein excretion is less than 1 to 2 gram in 24 hours. Nephrotic range proteinuria is defined as 3.5 gram in 1 day or in 24 hours or more, and almost always reflects the significant glomerular disease. So we can see that in the case of proteinuria, the protein content in the urine increase as compared to the normal adults. Proteinuria found in many people with polyuria. Protein in urine diagnosis. So how we can diagnose the proteinuria? There are some tests through which we can diagnose it. It's like blood tests. These measures the certain chemicals to check how well the kidneys are working. Or imaging tests like CT scans and ultrasounds can spot the kidney stones, tumors or other blockages in the urinary system. A kidney biopsy. A doctor might need to take a small sample of the kidney tissue so a lab technician can look at it under a microscope. So in the kidney biopsy, a small sample of the kidney tissue is taken and then it is examined under the microscope, and hence we can diagnose the proteinuria by biopsy too. If we talk about the treatment of the proteinuria disease, so it includes dietary changes. We need to change our diet if we are suffering from the proteinuria. If one have kidney disease, diabetes or high blood pressure, a doctor will recommend the specific diet changes and the patient must follow a specific diet and must change its diet according to the recommendation by the doctor. And weight loss. Losing weight can manage the conditions that impair the kidney function. So patient of the proteinuria must try to lose their weight, because in this way he or she will be able to manage the conditions, and that will ultimately lead to improve the kidney function. And the third point showing that blood pressure medication. If one is suffering from blood pressure too, one must take the medicines of the blood pressure to maintain the blood pressure level to the normal. If one is suffering with along with the proteinuria and also suffering with the diabetes, so one must take the medicines of the diabetes, and the dialysis is done for the removal of the proteins, or sorry, to perform the function of the kidneys, which they are not performing, but we will do the dialysis outside the body, or so that we can filter out the blood in a proper way. Because in the case of the proteinuria, proteins are not being filtered out by the glomerulus of the kidney, and they are coming into the urine in an excess. So dialysis is the solution of this problem. It is not a permanent solution, but it is a temporary solution to filter out the blood and to filter the blood and to filter the proteins so that they don't come into the urine and they are reabsorbed. In this way, dialysis helps to temporarily filter out the blood, and yes, this involves the treatment of the proteinuria. Moving forward, if we talk about the renal calculi, what it is. It is also called the kidney stones, or it is also called the renal calculi, nephrolithiasis, or urolithiasis. So what happens in case of the renal calculi or kidney stones? It involves the hard deposits made of the minerals and salts that form inside the kidneys. So therefore they are called the kidney stones. Diet, excess body weight, some medical conditions, certain supplements and medications are among many cases of kidney stones or renal calculi. So in kidney stones, hard deposits accumulating in the kidneys, and they are made up of minerals and salts. Therefore they are called kidney stones. And if we talk about what are the cause of it, it may be due to a specific diet, or excessive body weight, or the medical conditions. Some medical conditions are maybe we are taking some certain supplements which are involved in the kidney stones, or either we may be taking some specific medicines which may be playing their role in the kidney stones. So moving forward, kidney stones or renal calculi are solid masses made of crystals. Kidney stones usually originate in your kidneys. They can develop anywhere along your urinary tract, like kidney, ureters, bladder, urethra. So they are not limited only to the kidneys, but they can be developed anywhere in your urinary tract, like in the ureters, in the bladder, in the urethra too. So they are not only limited to the kidneys. In this diagram we can see this is the nephron structure, and we can see that this part of the nephron is called glomerulus, which is involved in the filtration of the blood, and these are the capillaries surrounding it, and this is the tubular-like structure, which is called loop of Henle. And yes, this one is the collecting duct, which collects all the urine, and it will. How kidney stones are treated. So there are the certain methods for the treatment of the kidney stones. First one that we are going to discuss is medication. The medicines which can be recommended by the doctors are allopurinol for the uric acid stones treatment, sodium bicarbonate or sodium citrate to make the urine less acidic, phosphorus solutions to prevent the calcium stones from forming. And the next treatment is lithotripsy. Extracorporeal shock wave lithotripsy uses the specific waves, which are the sound waves, to break up the large stones so they can more easily pass down the ureters into your bladder. This process or procedure can be uncomfortable and may require light anesthesia. It can cause bruising on the abdomen and back and bleeding around the kidney and nearby organs. And so this procedure is quite uncomfortable, and it mainly includes the shock waves, which are extracorporeal shock waves. So these shock waves are used to break large crystals into those very smaller particles so they can pass down easily into the ureter and then into the bladder, and then they will be excreted in the urine. In this diagram we can see the lithotripsy. So if supposed this is the kidney of a patient suffering from the kidney stones. For example, if the kidney stones are present in the ureter at this place, so the shock waves will be passed through this part of the ureter, and the shock waves will break up the stones in the ureter, and in this way they will be passed through the bladder. UST shock waves crush the stones. What are the UST shock waves? UST stands for ultrasound guided extracorporeal shock waves. So when the kidney stones are too large, they cannot pass through the ureter or bladder, and they cannot be excreted in the urine. So they needed to be break down. So for this we will use the ultrasound shock waves that will crush the stones inside the kidney, and smaller pieces will then pass out of the body in the urine. So in this way this technology will help us to break the stones into the smaller pieces so that they can easily pass out of the body in the urine. And so the next one is ureteroscopy. So what is it? It is basically a procedure to address the kidney stones, and it involves the passage of a small telescope, which is called the ureteroscope, which is a device or instrument. So it will involve the passage of ureteroscope through the urethra and bladder and up the ureter to the point where the stone is located. So with the help of the ureteroscope, we will be able to address the kidney stones. So when a stone is stuck in the ureter or bladder, your doctor may use an instrument which is called the ureteroscope, which is like a telescope like instrument, and it will be used to remove the kidney stones. And the next treatment is the surgery. A surgeon removes the stones through a small incision in your back. So it involves the opening of the through your skin, and they will like do the surgery and then they will remove the stones. And if we take an example of it, like nephrolithotomy, it is a removal of an intact stone. So here we can see the diagram which involves the nephrolithotomy. So it involves the small incision in the back, and through which the surgery can be done and kidney stones will be removed. But the nephrolithotomy is very risky because it may involve the infection